Have you been diagnosed with ulcerative colitis, UC? You're not alone. This chronic condition causes inflammation in the large intestine, leading to flares with unpleasant symptoms. While there isn't a cure for UC, this video will explore ways to manage it and live a fulfilling life. We'll cover what UC is, how it's treated, and what you can do to feel your best. Ulcerative colitis is a chronic condition, meaning you'll have it for a long time. It causes irritation and sores inside your large intestine, also called the colon. UC is a type of inflammatory bowel disease, IBD, similar to Crohn's disease. The main symptoms of UC are bloody diarrhea and cramps in your belly. It can also make you feel like you need to use the bathroom more often. UC comes and goes. You might have periods with symptoms called flare-ups, followed by longer periods where you feel fine, called remission. The type of UC you have depends on where the irritation is in your colon. It usually starts near your rear end, rectum, and can spread to different parts of your colon. Ulcerative proctitis. Only the rectum is affected. Proctosigmoiditis. Affects the rectum and the lower curvy part of your colon, sigmoid colon. Left-sided colitis affects the entire left side of your colon. Pancolitis affects your entire colon. UC can be mild, moderate, or severe, depending on how bad your symptoms are. A very serious form, called fulminant colitis, is rare, but requires immediate medical attention. Ulcerative colitis is a chronic bowel disease, like Crohn's disease. It affects about 1 in 250 people in North America and Europe, with nearly 1 million people in the US alone living with it. UC symptoms come and go, with flare-ups, periods with symptoms, followed by remission, periods without symptoms. They can vary from mild to severe. Early signs of UC might be diarrhea, maybe bloody. More frequent bowel movements, up to 4 times a day. Urgent need to use the bathroom. Feeling like you need to go but can't, tenesmus. Mild belly cramps. As UC progresses, symptoms can worsen to include very frequent bowel movements, 4 or more times a day. Blood, mucus, or pus in your stool. Severe cramping, extreme tiredness, sudden weight loss, nausea, fever. Flare-up severity can differ greatly. Some people have mild symptoms while others battle frequent fevers, bloody diarrhea, and severe pain. UC can also affect other parts of your body in up to a quarter of cases. This might cause joint pain, eye problems, or skin issues. Having ulcerative colitis, UC, means you might be at risk for other health problems. Here's a breakdown of some potential complications. Anemia. Because of severe bleeding in your colon, you could develop anemia, which means you have fewer red blood cells. Colon cancer, UC, increases your risk of colon cancer. The risk depends on the location and duration of inflammation. Talk to your doctor about your risk factors. Weak bones. Inflammation can affect your bones and joints, leading to bone weakening, osteoporosis. Liver issues. In some cases, inflammation can spread to your liver, causing a condition called primary sclerosing cholangitis. This damages your liver and affects its function. Growth problems in children. UC can limit a child's ability to absorb nutrients needed for growth. Along with UC medication, your child might need vitamin supplements. Now let's talk about emergencies with UC that require immediate medical attention. Dehydration. Frequent bathroom trips can leave you dehydrated. In severe cases, you might need IV fluids in the hospital. Hole in the colon perforation. A hole in your colon is a serious situation and requires immediate treatment. Severe bleeding. Depending on how much blood you lose, you may need a blood transfusion. Toxic megacolon. This rare complication happens with severe inflammation. Your colon stops working, waste builds up, and toxins leak into your bloodstream. It's most common with fulminant colitis. Blood clots. UC increases your risk of blood clots, which can be life-threatening depending on their location. Remember, early diagnosis and treatment of UC can help manage these complications and improve your overall health. Figuring out if you have UC involves a doctor's visit, tests, and maybe a procedure. Here's what to expect. Doc Chat. When you visit your doctor, they will start by asking about your symptoms such as diarrhea, abdominal pain, and any other digestive issues you're experiencing. They'll also ask about your family history to see if there's a pattern of similar conditions. Blood tests. These are important to check for anemia, which is a condition where you have a low number of red blood cells. Anemia can result from bleeding in the colon, a common issue in people with ulcerative colitis, UC. Blood tests can also help rule out other conditions that might cause similar symptoms, like infections or other inflammatory diseases. Stool sample. By analyzing a sample of your stool, doctors can check for signs of infection, parasites, or inflammation. This helps in determining whether your symptoms are due to ulcerative colitis or another cause, such as bacterial infections. Imaging tests. Various imaging tests provide a detailed view of your colon and rectum. X-rays, Connecticut scans, or MRIs might be used to identify the extent of inflammation and any complications. A special X-ray called a barium enema involves inserting a liquid into your colon, which helps highlight areas of inflammation on the X-ray images. These scans are particularly useful for diagnosing moderate to severe UC and detecting serious complications like blockages or perforations in the colon. Endoscopy. This procedure uses a thin, flexible tube with a camera, endoscope, to look inside your colon. During a colonoscopy, the entire colon is examined, whereas a sigmoidoscopy focuses on the lower part of the colon. Endoscopy is a key tool in diagnosing ulcerative colitis and assessing its severity. These steps are crucial in accurately diagnosing and managing ulcerative colitis, ensuring that you receive the best possible care and treatment. There are two main goals for treating UC: achieving remission, reducing symptoms to zero during flare-ups, and maintaining remission when you're feeling good. Medications and surgery are the two treatment options. Medications includes aminosalicylates. These medicines, like sulfasalazine or mesalamine, help reduce inflammation and promote healing in your colon, easing symptoms like pain and diarrhea. Corticosteroids. For severe UC cases, medications like prednisone or budesonide might be prescribed. However, due to potential side effects, doctors prefer short-term use of corticosteroids. Immunosuppressants. These medications like 6-mercaptopurine, azathioprine, or methotrexate calm your overactive immune system to control inflammation. Biologics. For moderate to severe UC, biologics like infliximab, adalimumab, or vedolizumab target specific parts of your immune response to reduce inflammation. Janus kinase, JAK, inhibitors. These newer medications like tofacitinib target specific enzymes in your body to stop inflammation. Upadacitinib and ozanimod are other JAK inhibitors used for UC. Remember, these are just some examples, and your doctor will determine the best course of treatment for your specific situation. Surgery is considered when medications fail to control UC or if there are serious complications. Around 30% of people with UC and 20% of children with UC eventually require surgery. There are two main types of surgery for UC, both involving removal of all or part of your colon and rectum, proctocolectomy. Proctocolectomy with ileal pouch. This is the most common surgery for UC. It removes your colon and rectum but preserves your anus. The surgeon then creates a pouch from your small intestine, which acts like a new rectum and allows you to have bowel movements in a similar way to before surgery. Proctocolectomy with ileostomy. If an ileal pouch isn't possible, this surgery might be recommended. It removes your entire colon, rectum, and anus. An opening, stoma, is created in your abdomen, where waste will be diverted and collected in an external pouch you wear on your stomach. You'll need to empty the pouch regularly. Living with UC involves managing flare-ups and maintaining remission. Here are some tips. Identify and avoid triggers. Keep a diary to track what worsens your symptoms, stress, certain foods, etc. Manage stress. Getting enough sleep, exercising regularly, and finding healthy ways to relax, meditation, can all help. Diet. Some people find relief by avoiding dairy and high-fiber foods. Work with your doctor to create a personalized meal plan that avoids triggers without sacrificing nutrients. Medications. Taking medications regularly as prescribed by your doctor is crucial for preventing inflammation and flare-ups. Doctor visits. Regular checkups with your doctor are important to monitor your health and adjust treatment as needed. This might include regular colonoscopies to screen for colon cancer, depending on your individual risk factors. UC can be unpredictable, with some people experiencing just one flare-up and others having ongoing symptoms. However, most people with UC can manage the condition effectively with medication, dietary changes, stress management, and regular follow-up with their doctor. The goal of treatment is to achieve and maintain remission for an improved quality of life. Living with ulcerative colitis UC can be challenging, but with proper treatment and lifestyle changes, you can manage your condition and live a fulfilling life. Remember, the key is working closely with your healthcare team. They'll help you identify triggers, develop a treatment plan, and monitor your progress. By taking your medications as prescribed, understanding your risks, and following your doctor's recommendations, you can achieve remission and improve your overall health. Remember, open communication with your healthcare team is crucial. Ask questions, express any concerns you have, and actively participate in managing your UC. Please click on the next video for more Live Good info. Thank you very much.